Welcome back to another episode of the Hopecast. Today, Steve and I with Brian, and he just stepped out.
Yeah, Brian will be back. He pushed a button and said, "Wait a minute, that's not the one I wanted to push." So
There he goes.
Brian came back to join us. Brian, hi. We were just
Hi.
talking about you.
Yes, sir. Somehow it got disconnected, but I do apologize.
Hey, it's not a problem. So Brian, you're joining us. Richard said you're new to the club. What we would like to do is get a little background. If you have numbers, you can walk us through what's happened so far, and then we'll
Um,
get into this.
I I was actually diagnosed in May. Um, it was stage 2, uh, contained in the prostate, and I've had PET scan, MRI, bone scan, and I just met with my surgeon earlier this month at the Mayo Clinic in Jacksonville, Florida.
Hmm.
And they're supposed to be scheduling surgery the first of October. Haven't gotten a date yet, but very excited. The surgeon has performed over 1,000 of these procedures, and they do 4 or 5 a week. So I'm very confident that we have a good surgeon.
There you go. That's the important thing because they're going to talk about nerve sparing and all of that. So,
He
uh,
specializes in that as well. So that was definitely something that I was excited about.
Yeah.
yeah, and hopefully you can get excited about the outcome.
Right.
But you know what? That's a lot of the people that are going through this. They get diagnosed, they get slammed with the C word, they freak out, and then somewhere around question 2 or 3 after the why me's, it's going to be what side effects am I going to have? How is this going to
Right.
affect my little friend because he's been around with me my whole life? And
Right.
I think that is, and I don't know if it's a guy thing when you go, uh oh, but there is a psychological journey that goes along with this physical journey.
Yeah.
And you have people on your team, correct?
Yes, sir. Yes, sir. Um, I I'm a spiritual guy, and I just truly believe that everything happened for a reason, and things I can't control, I don't worry about. Right now, the human side says I need to be worried about that. But the spiritual side says God is in control. And so I lean more towards the spiritual side
Yes.
because me worrying about the side effects would only cause more problems. It's not going to help anything. So I put to focus on the positive and be optimistic towards the future.
There you go. Well, hopefully everything goes well. Now, did you do a lot of research? Did you have a lot of doctors involved, or how did you make your decision?
Well, the group the support group that we have is very has a lot of resources, a lot of knowledge, a lot of people that have both positive and negative experiences with this, and I have just enamored myself with that support group. Every night I go and just research and read the comments, and one of the things in particular that I got that helped me tremendously was someone said that look for a facility that's a part of the National Cancer Institute. Well, unfortunately, Mississippi don't have one in Mississippi,
Okay.
so that led me to looking for either MD Anderson or the Mayo Clinic. And my sister-in-law lives in Jacksonville, so I chose Jacksonville because both those hospitals are there. And
Right.
the Mayo Clinic was the first one to respond, so that's why I went with them.
All right. So you've discussed all of the complications, I guess, on the backside.
Yes, sir. Yes, sir.
Bones.
Go ahead. I'm sorry.
No, you go ahead. I
Yeah,
was preparing my next.
I like I said, dove deep into the side effects, the leakage, the ED, and then the psychological, like you said before, the psychological aspect of, me not feeling like a man, so to speak. You know what I'm saying? A lot of guys suffer with that. And I try to prepare my wife. You expect the worst and hope for the best, right? And so try to prepare my wife for that time if in fact that does happen, so it wouldn't be blindsided. But she says she's just concerned about me being healthy and
There
alive.
you
But
go.
and I appreciate that, but at the same time we still have to discuss those things that could potentially happen as well.
That's true.
Yes. Well, I have a plethora of knowledge over those two things.
Yeah, yeah, yeah,
Leakage. First thing, I can't stress this enough. Ask your doctor about sending you to pelvic floor physiotherapy.
yeah,
That helped me tremendously. Whoa, see that? So
yeah, yeah, yeah,
it I was leaking so bad I was like afraid to get out of the shower because like man, if I step out of the shower right now, I'm just gonna pee all over my bathroom floor.
yeah,
And it
yeah.
was crazy. But I went to this pelvic floor physiotherapy for 2 months, and they got me down to like 95% dry, and I'm almost never leak now.
Wow. Yeah, I,
Yes.
I saw
Yeah.
that too in the group. They got a lot of files. They got a lot of,
Mhm.
like I said, a lot of resources that I've dove into. Guys like yourself that reached out. I have a lot of people that have reached out to me as
Yeah.
well. I'm only 47 and no
Oh,
family history,
yeah, you're young.
um, no symptoms. It's just that I went to a routine checkup and I had got a new doctor and she wanted some baseline numbers, and that's how we found out.
What were your numbers? Do you remember?
My PSA was 27.4.
Wow.
Hmm,
Yeah.
Yeah, yeah.
that's crazy.
And you didn't have one before that, right?
No,
So,
the sad part about it is I was diagnosed as a diabetic back in 2015. So I go to the doctor every 3 months. And I was going to my doctor every 3 months since 2015. And
Yeah,
right,
none of this was ever nothing.
right. I
So
don't, you know how many people I have asked since I was diagnosed and went through all this? How many times I've said, "What's your PSA?" And they're all, "What?" And it starts a conversation that goes because they don't know. We don't talk about it. Men's
right,
health is not the topic. No, we can't talk about that. And incontinence, no, we need to talk about
right.
football. Arr, arr, arr. And they
Absolutely.
want us to do that and just sweep this under the rug. Well, damn it, it affects a lot of people. And
Right,
there's a lot of problems, a lot of complications that can happen. And if you're not talking about those things and what it's going to do to you emotionally, then we're not doing our job on the
right.
podcast
You
because
know,
I have talked to a lot of people that didn't have a clue.
I think when we go through certain things, God chooses us for those specific battles. And I think I was chosen because um, I have a lot of people that listen to me and follow me and seek out my advice for whatever reason. And I think I was chosen to be a beacon of hope and encouragement and information for those people that, like you say, don't really talk about it, never really sought out, what needs to happen for men's health. Because we don't go to the doctor, right? We tough it out until we can't tough it out, and then at that point it's too late. So
yeah,
yeah,
So I
yeah.
don't know how to turn that around other than wear shirts and talk to people and keep doing what we're doing and hope people will share it because this is scary. I don't care what the numbers are. It's a
yeah,
scary, scary disease.
right, right. And the thing is, my friends now, they've all gone to get their colonoscopy. They've gotten their PSA checked, so it's helped some people for
Right.
sure. And that's what we want to bring attention to, bring awareness to this nasty disease that a lot of men, especially African American men,
Oh, yeah.
suffer from because we don't really believe in going to the doctor. And it's a sad reality. It's epidemic level because most of us feel as though when we go to the doctor, it's going to always be a negative outcome.
That's a great point. I always wondered why this disease hit African American men more so than Caucasians or any other
Yeah.
race.
Yeah, we don't tend to go to the doctor, man. Even though we pay for insurance, we work, we have health insurance, but
Yeah,
we typically don't go. We'll take Tylenol, sleep it off, and
yeah,
hope it'll get better to the point where we in pain. We just try to tough it out, man. Because our grandparents, they really didn't they didn't have insurance, so they couldn't go to the doctor. And so it's just not something that was particularly practiced in our neighborhood, stuff like that.
so true.
So what is the next step? Obviously, your bone scan didn't show anything outside the prostate bed.
What about your,
Right.
biopsy? Did you have a
What's
biopsy?
what'd your biopsy show?
So the thing is, my doctor, I had a biopsy. He said it was I think intermediate. I don't know what that means. But he didn't give me the numbers, right? He
Right.
he just he just said that it was found in both sides of the prostate, but he didn't put numerical context to it. And so
Um,
Yeah, so most people get like a 3 plus 4 or 4
yeah,
plus
yeah.
yeah,
So those
well,
those numbers I didn't get, right?
yeah, I would say a 3-4
that's what I was
is
gonna
going
guess.
to be, yeah, a favorable, a 3-3 isn't going to
Yeah.
be the deal, but like a 3-4, if it
I
was a
know it was 7. I
4-3,
think the numbers together was
yeah,
7.
Yeah,
yeah,
But
that's
I'm
Peter.
not sure if it was 4-3 or 3-4. I'm not sure.
I'm pretty sure it's 3-4 because 4-3 is bad, 3-4 is
yeah.
doable.
Yeah. Okay. Okay.
So yeah, I mean it's all bad and it's all
Yeah.
quote doable, I think. But
Yes.
yeah, when you're in that zone, you okay, I'm a little better. Now when they start talking, did you have a decipher score done? Probably can't do that until afterwards. Yeah,
Yeah,
so
I think
anyhow, there's other things that they can do when it's on the backside
right.
because I don't know how much Richard told you about my journey, but I had surgery August 28th of last year.
Hmm.
I had clean PSA, undetectable, and then it was detectable, then it doubled, and then it doubled again. And they said, oh no, you have chemical reoccurrence. And he was doing, it was 0.08, and then it went up. He said that he didn't know because they didn't do a ultra sensitive. He said, so it was under 0.3, I think is what this lab used. And I go, well, that's not going to tell us anything. But
Yeah.
we're doing dual band radiation, doing prostate bed, and doing all the lymph nodes. And on top of that, I'm doing the hormone therapy.
Hmm.
And I'm telling you what, it's kicking my butt. He said it'll get better when we drop the 2 zones down to 1. It'll get better when I'm done with all that because I never had the incontinence issue, but now I have a you got to go. If I say, hey, you know what, we need to find a gas station, it's either that or a side road because, I can't wait as long as I used to since
Yeah.
I started doing this radiation. But they all have complications. And when you mention that Facebook support group, it kind of makes me cringe just a little bit because of the way some of the people are treated after they voice their opinion on the decision they made.
Yeah.
Richard posted something, and oh my gosh, they came at him and just belittled him and said, "You
Yeah.
don't know what you're talking about. Radiation's the way to go." And I went, "Whoa, whoa, whoa, slow down." Well, someone had posted something about they had to do, hey, I'm going to have my prostate removed, and people had commented, and people started to play that game of, radiation is also available, and yeah, it is, but here's the deal. It is a personal journey, and that is
Right.
what they decided. Do not tell them that they are wrong. You're going to have people on both sides of this that don't have the favorable outcome that they wanted, regardless of what they choose.
Right.
Mine was a lot more aggressive than we thought going in. It had escaped. There was some invasion. So today he said, look, we're treating this area. It could be anywhere. And we know that, but there's a better chance that it's where we're radiating. Kind of a shotgun approach, but we have to do what we can with the knowledge that we have. And I said, go. So trusting the team and understanding what's going on with your particular journey. But when that Facebook group starts getting ugly, I start getting defensive, not just because it's Richard, but because this is scary. When you make a
Right.
decision, are you going to regret that decision? The people on that page, the people like Richard that go through this and have a really good outcome as of right now, and we're knocking on wood for you, bud.
That's
But
right.
as we go through this, there you go. And if your numbers keep being the way they are, that's awesome. He wouldn't be part of that page if he was better. If he had gone a year or two undetectable, he's going to fade away from that. That's
Right.
people that are newly diagnosed that are coming to the page for answers, or it's people with reoccurrence, or people that are upset because something happened on the backside.
Right.
They're going to have an implant now because, or do injections because it's not working. But you know what? You're alive. You're still sucking air. So let's move on and try to educate people so it's not to the point where it's so far gone before you
Right.
catch it. I want them to catch it like yours. It's
Right.
intermediate, scary a little bit. Let's get it out of there. If it's
Right.
contained to the prostate, and if it's a, well, you have a couple lesions apparently if it's in both lobes, right?
I think Brian is very similar to mine because I had the same exact pretty much leading up to surgery. I had it in both. I
Right.
had 2 lesions. I had
Mhm.
a intermediate. I had 3, 4, and it was a 6 in all my samples from the biopsy, except for one was a 7. So that's what made it go time. We have to either do surgery or radiation chemotherapy type thing. And I didn't even think about it. I just right away said surgery. I didn't even leave the surgeon. I didn't. My urologist is my surgeon also. I didn't even leave his office. Went right straight to the scheduler and had a schedule surgery scheduled before I even left his office the same day he told me I had cancer, because I was like, I already know. I saw my mom go through it. I don't want to do what my mom went through. That stuff looked horrible to me. So if it's surgery's on the table, that's what I want to do. And then if it comes back, then we'll tackle it however we want to tackle it at the back end.
And my doctor, my urologist recommended surgery after the biopsy, and I just wanted to get a second opinion. So
Yeah, of
when
course.
I went to MD, the Mayo Clinic, first before that, my friend, my barber, old barber, he had prostate cancer last year. He just finished his radiation the same month that I got diagnosed, and so he had the cyberknife surgery,
Okay.
and he just had his PSA, 3-month PSA, and it was elevated. And so
Mhm.
now they got to go back and try to figure out, is this just a false positive or do we need to do
Right.
something else? So,
Right.
but when he told me about his experience with radiation, I knew then I'm gonna try to tackle the surgery. I just didn't
Yeah.
want to, like, you got 6 in one hand, half a dozen in the other.
Yep.
And so, like you said, it's a personal choice. But I didn't want to do the radiation if, in fact, it got outside the prostate, and then surgery wasn't an option.
Right.
I'd rather do the surgery. If it gets outside the prostate, then we can do radiation.
That was
You know?
exactly my thought process also.
Yeah,
And
yeah,
even though I chose right then and there surgery, but he also said that, you could change your mind up until,
right.
so I just went ahead, scheduled the surgery, and I knew I had a doctor's appointment with my primary care the following week. So when I
Hmm.
went in there, he already knew from, the urologist already had forwarded him all my stuff. He already knew that I had prostate cancer at that time. And I asked him, I said, I elected surgery, uh, and I just wanted your professional opinion. And he said, I think you're making the correct choice. And I said, okay, now be honest with me. If you had prostate cancer and you were in my shoes, what would you choose? Would you choose surgery or would you choose the other route? And he said, surgery. He said, I have, out of all my patients that have prostate cancer, I have 2 of them that went with the chemo instead of the surgery. And he said they are by far behind the 8 ball health-wise than what the other guys are motoring through. And so I
You
was
know,
just like, yeah, I'm
my,
going.
my mother-in-law had a friend that he's a doctor. He's an MD, and he had prostate cancer. And I spoke with him, and he told me that he would recommend surgery. He went through surgery himself at MD Anderson, and he was like, why play around with the radiation and it puts you, like you say, behind the 8 ball if in fact
Yeah,
it gets outside the prostate. So it's like, go ahead and get it out. And if it does leak outside the prostate, at least you have a secondary treatment option as
exactly.
opposed to, just trying to live with it growing and spreading. So, but I
Yeah. I mean, it makes sense to me, right? I mean, all 3 of us chose surgery, and mine, big mass, get it out of me. And in the hospital, here's what I don't really understand, because in the hospital, they said that they think that it was outside the margins when they did the surgery and there was some invasion. And I said, okay, so now what? Said, well, we have to watch because we dealt with the big mass. Now we're going to deal with it on a microscopic level. This is going to
yeah,
just be individual cells. Now, the cells, become 10, become 100, become 1,000. You have to be careful. The, the doctor today, I actually got to speak with the doctor. My wife drove me over there, so she had questions as well and brought up, chemo and said, well, I'll tell you, you actually would be a candidate for chemo, right? With your numbers and the way it is, but it will destroy your body. If you
yeah,
think the radiation and all this other stuff is having issues, you need to understand that you really don't want to do that. And we have found that with prostate cancer, chemo isn't as effective as doing the hormone therapy to get rid of your testosterone and then do radiation at the same time. And so, I mean, they're steering all of this because all of this is pretty new technology. It wasn't
mhm,
too long ago, one of us would have died on the operating table because they laid you all the way open and started digging for pieces
right,
where we didn't do that. Now your friend that had the cyber knife, they're going in focused,
hmm
radiation, boom, mass radiation over a 3 or 5 session period, and you're good. Talked to a gentleman that was in there. He said as soon as he did that, they made him do radiation, the regular, we're going to radiate your prostate bed. And I thought, well, wait, now you got a double whammy, a crazy radiation. Then you waited and had this one done. Well, it said that I could have started, or may have, probably should have started my radiation right after I was healed from surgery within that
hmm
6 month time frame. We waited a year and those numbers started going up. Well, now we don't know where the cancer is.
right,
Right. So you're playing that numbers game going, there is a 68% chance that it's going to be in your prostate bed
yeah,
somewhere there. And I go, these numbers are scary. But if you had radiation and your PSA started going up, you still have a prostate.
right,
So the prostate is going to produce some sort of PSA at that point, even though
right,
you've zapped it. You get it removed if you have PSA that's detectable on the test, then you could have
pretty
chemical
much no,
reoccurrence. And
right,
yeah,
right, right,
now we had someone on saying, well, remember, other organs produce low amounts of PSA and blah blah blah. That's true, but it's not going to be detectable. It's not going to keep rising. It's not going to double in a short amount of time.
right.
So we get to go now. Richard, you have done your 3 and your 6 is coming up, right?
It's right around the corner.
That's what I was thinking. You have to be within a month or so of that.
Yeah, it's early September, I think. But I go see a VA doctor on Friday, so I'm gonna try to pin this on the VA.
Yeah, just make
Let's see what
sure
happens.
ultra sensitive. Because
Yes.
if they do the other one, you want to know if anything goofy is happening.
Right.
And so
Yes, definitely.
you
Yeah,
get on that one.
I have an MRI scheduled prior to surgery just to
Mhm.
make sure that it's still contained within the prostate.
So have you had a PET scan already?
Yes, I had a PET scan. So my insurance
Oh boy.
denied the PET scan initially.
Right.
Yeah.
They said they didn't see it as medically necessary. So I did the CT and the bone scan,
Hmm.
and I told my doctor I still wanted to do the PET scan. So he submitted it again. They approved it at that point. And I did the PET scan, and it had not spread outside of the prostate. It was still contained. But the guy, when I went to the Mayo Clinic, said the day before surgery he would do another MRI just to make sure before he does surgery that it's still contained.
Right.
Yeah,
That's awesome. Yeah, you
yeah,
need to give him a hug. Um,
yeah.
when they're that serious about your treatment, you have to trust them, right? And when they're going to
Right.
do that, I was in the same boat, didn't get to have my PET scan till after I had my prostatectomy, and we started back with this. And I said, we're not going to see anything unless there's already a mass somewhere
Right.
because the PSA wasn't high enough to be detectable in the PET scan. But kind of cool that they're allowing you to have another one with the insurance because yeah, those they don't just hand out. That's kind of cool that they did it. A lot of people they'll deny the first one
Yeah.
until you have reoccurrence or you have an issue that you need it. But kind of a neat thing that they're going to do it now. If they find something, all bets are off. Then you would start doing a different option. Or are you going to still? Eh,
If it goes outside the prostate, I'm not going to do surgery. I mean that'd
right.
be ludicrous, to do that. I would go with the probably go with proton therapy as opposed to well, it's a form of radiation anyway,
Yeah.
but I would probably try to see if that would be a more viable option as opposed to just I don't know. I mean, I hadn't thought that far.
Right.
Preferably, it's still contained, and we can just
I'm
go
sure
ahead and get it out and
yeah,
do
I'm
what
sure
we
it's
need.
still contained. It doesn't move
Yeah.
that fast.
Not if, and we know this, which is why we're having problems with Biden saying he didn't have any issues and all of a sudden was a stage 4 bone cancer spreading. He had tests, he knew.
Right.
Yeah, but it is scary when you're at this point because you go, okay, surgery. And if something happens, you go, wait, now what? They're going to go, well, we should probably do. At that point, they're going to do, it would be because they found another tumor. Like you said, they would cyber that one, try to do a pinpoint therapy. But at the
Yeah,
same time, you would be doing chemo probably.
yeah, yeah. And I was vacillating between the two at first, and then I was like, you know what? Let's go ahead and get it out because if it's there, even though they zap it, it can have some leakage. And it
Yep.
could leak. I'd rather get it out and hopefully they get it all out when they go in and be done with it, and
Yes.
we can just live our new norm, live the new norm, and just be great with that. So
Are you doing your Kegels?
I just started. I mean,
You go,
it
oh,
it, it
there's
kind
that
of
other
feel
thing we
weird.
never talked about. Yep.
Yeah, yeah, it kind of feel weird, but I have been doing it. And the great thing about it is they want you to do it a couple months before and after.
Yep.
And this gives me almost, roughly 2 months to do it, to get it in, to practice and start doing the exercises. So I think I'm gonna be in a pretty good position. I got to lose some weight though. The doctor says that I had to lose about 20 pounds for surgery. So
Really?
yeah, I'm about 270, man.
Okay. I wouldn't
Yeah,
have guessed that with you
yeah,
sitting there. You were looking
yeah.
good. All right. Well,
Yeah,
270. Come on. That means you like to eat. And that's
yeah,
my thing. Yeah.
absolutely. So we gotta. He said, it'll help him, but the surgery will go forth. But he said it would just be better if I could lose some weight. So yeah,
Well, the reason I asked about your exercises, that is the number one thing. Once they say, we're going to do this,
Yeah.
we're going to do something, you start those immediately because I didn't have
And walk.
any issues at all.
hmm
But I did a lot of walking, like he said, and did a
Walk often.
lot of the exercises to prepare myself because I was my main concern, I don't want to be walking around smelling like a diaper,
right,
right?
right,
That was my thing, and you go, well, that's silly. You can wear that. It didn't matter, that in my brain, I said I do not want to, smell, and people go,
right,
what the heck,
right,
um, but lots of exercise. But I'll tell you, now that I'm doing the radiation, um, I've been doing them constantly. I have not stopped since we started because I don't want to have to put that on top of all the other BS that I'm dealing with, right?
right,
So
right,
I'm going to make sure I go. Richard had great success, and he is being a spokesman for getting these appointments together so you can go to a pelvic floor therapist that will demonstrate, not demonstrate, but help you make sure you're doing them correctly and giving you other
Mhm.
things you can do. Um,
right.
Yeah, there's
but
plenty of YouTube videos, man, but
yeah,
it's so much nicer to have a doctor in front of you when you're doing it.
Right,
to
right,
make
right,
sure that you're doing it right. But like you
Yeah.
said, the YouTube videos are there. And this is something that, again, we need to get this stigma away from men's health, and we need
right,
to talk about these things. It doesn't hurt. And it's weird. Once you open up to somebody about this, they'll come back to you with questions, and all of a sudden, that's that relationship you have. It's like, you can talk about it. I'm not going to repeat it. Number one. Number two, I can help you maybe. If not,
right,
let's get you some good information so you can at least learn about it. But
right.
I have people that said, oh, last 3 physicals I had from my DOT, I had protein in my urine. And I said, what's your PSA? And he goes, I don't know. They haven't done it. And I go, how do we fix this if we can't get this education to the people that need it? I
I,
mean, it's
I I always wondered why hasn't the PSA been a baseline test for patients anyway when they get a certain 35, 40? Why won't that be an initiative of the doctors to do it? It seems
Yeah,
as though it
that's
would
the
be
million-dollar
something they would
question.
do.
Yeah.
Right.
When I went into my urologist for the first time and he looked at my numbers, he literally told me, he said, you need to go back to your primary care, physician, and you need to thank him for saving your life." He was surprised that we caught it so early. So, apparently, that's not a thing, and I don't understand why. Why is it not a thing?
I don't know.
My
I,
doctor, the reason why I got this new doctor, my doctor in November decided he wanted to do research from UMMC. So I had to get a new doctor, and this is internal medicine doctor. So I got with another doctor in the same facility, same office, and she had no nonsense type doctor because my A1C was kind of high in January, and she was going up one side, coming down the other. Said, "Listen, my name is on your chart now. We can't have this foolishness. You need to get yourself together." And she was asking me about my PSA. I said, I don't even know what that is, man. Be honest with you, I don't know what that is. She said, we're gonna run these tests. Well, I came back. That was April when I came and had the PSA end of April, the end of April. And when it came back, she was concerned because it was high. I was like, well, what does that mean? She said, well, it could mean a lot of things. It could be, UTI. It could be just your thyroid, or it could be prostate cancer. So to eliminate that, we're going to set you up with a urologist. And we did that and came back. That was like a week later and came back and it was, in fact, prostate cancer. Now, when I got the call from my doctor's office, a nurse called and said, listen, is this Brian? Yeah. Just calling for Dr. Blaylock's office. I was letting you know about your biopsy. Just want you to know you do have cancer. I was like, wait a minute, man. Wait, whoa. You cannot drop that on me like it's you telling me eggs on sale at Kroger. I
Yeah.
mean, have some sympathy towards what you. I said, I know you do this on a daily basis. I
Yep.
said, but when you tell people that, they're not used to hearing that on a daily basis. And she
Correct.
apologized. She's like, I'm so sorry. You're right. I'm like, you just telling me I got cancer, and you just moving on to the next subject. Let me give it some time to absorb it. So it was kind of crazy.
Yeah, I actually was told on the phone as well. But he goes, "Hey, I've got some news for you." And he goes, "Can we talk?" And I said, "Sure." And I was getting ready to go back to work. And I talked to him out in the carport, and he goes, "You have cancer, and we need to figure out what you want to do." So we had that 5-minute discussion, and he said, "I need to get you into to see me and all of the things that go along with it." So I turned
Right.
around, I came back in the house, and my wife goes, "I thought you were leaving for work." And I go, "I just got a phone call we need to talk about." So it was kind of weird, but
Yeah, same way.
you go,
I called
why?
my wife. I was headed to my next job, and I'm an in-home expert with AT&T, so I was headed to the next dispatch. And when I got the phone call, I called my boss and I told her, "Look, I can't. I'm gonna be done for the rest of the day." Call my wife, let her know. Call my mom, and it was just disbelief. Couldn't believe it. And sometimes now I still can't believe it. I just can't believe it. But that's a
Yeah, I
part of
would I would love to wake up. Oh, wait a minute, this didn't happen. I don't know. Who was this Richard guy I was talking to? Yeah, I need to figure that out too. I'd like to wake up from this, but it's weird when you said you didn't know what your PSA was. Didn't know
right.
what your PSA, don't understand it. What can cause it? And I go, well, Richard and I know we have a long list of things that can make your PSA rise, but it's that baseline. And that question you asked is awesome because I was talking to my sons and I said, look, you need to go in. I know you're young. He's 33. Is one of the
Mhm.
others 25? And I go, but when you go to the doctor, get a PSA test. And he goes, well, I don't think my insurance will cover it. I said, send me the bill. I
Right.
want you to have a baseline now. I want you to do it every year, every time. Go, hey, let's check that PSA again. I go, because I don't want you to go through what I went through. Now, they did the hereditary study and said that the cancer that I have isn't in that chain to be passed on to my children. And I go,
Good.
but you said I got it because my mom had breast cancer. So it's in that line that can go. Now my daughters are also in the mix to have everything checked. And I go, this is ugly. It affects everyone, but we need to wake everyone up. We need to be
Right.
able to talk about this and more than just a no shave November. I don't know how we get this whole PSA message out, but I think
Yeah.
I'm going to die trying.
Well, I have started being very vocal about it because so many people they just call me because when you hear cancer, your friends and your family think the worst. They do. And so a lot of people call and check on me, see how I'm doing. I just wanted to know. And the first question they ask, did you have any symptoms? I'm like, no, I didn't. And so I want them to be aware that you don't have to necessarily have symptoms in order to get this disease. You need to get checked and be sure, and not just walk around and well, I don't feel anything, because I didn't feel anything, but here I am,
Yeah. And I didn't either. I don't know why the doctors aren't doing these tests, or like you said, maybe 35 is the number, maybe 30. I see on the page the people are getting younger and younger that are being
Yeah,
diagnosed with this.
Yeah.
You know, Before it was 70s, I mean, they didn't really do too much.
right.
You're 70, 75, and they say it's the good cancer and it'll be okay. It's slow growing. It's not going to get you until it does, right? And they go, "Oops." But it wasn't too long ago we didn't have all the testing procedure and all of the things that are going on now. On a side note, are you getting a lot of people telling you that if you would have bee venom or use some kind of weird alternative, do this, that, or the other, that it's been known to cure cancer? And why haven't you tried it?
Well, you have these herbalists that say that your body heals itself, and I know a lot of people that believe in that, but a lot of those people also have died
Yeah.
taking these herbal stuff, and so I don't want to be the one to try something based on word of mouth when they have studies and research that have been known to work. Now, these herbalists, I don't know. I don't know if you have hundreds of thousands of um, people taking these herbs that is fixed. I don't know that, but I know based on the surgery or in fact radiation that a lot of people have done that and have seen success. So I'll take my chances with what I know as opposed to something that someone is suggesting. You know,
Yeah, everyone seems to have an opinion, even though they don't know what it's about. And
and
that,
don't have it. They don't have. Listen,
no,
I tell people this: you cannot tell me how to feel, what it's like, or what I should be thinking or doing if you're not walking in these shoes. You can't do it.
Right.
Now, you guys, of course, have been there, done that. I'll be more open to listen to what you have to say, being as though you have experienced it, as opposed to someone that tell me what they think.
right.
It's a different. I mean, because the psychological warfare that you fight, you can't explain it
Yeah.
because it's something that's growing inside you that you can't do anything about. And as a man, you're supposed to fix it. You are the protector,
There
provider,
you go.
everything. You're supposed to fix, but you can't do anything. So you're helpless. So I don't want to hear people that tell me what they think when they're not walking in these shoes, man.
Well, I think you're doing down the right path for sure. You're spiritual. You made your mind up, and whatever decision that you make, don't ever have regrets.
Right.
Even after the fact, if something happens and doesn't go your way, don't ever live with regret. Uh, just motor on and then take the next step. But I think it's very important, and well, I'll say this: it was very important for me, and I tell people this all the time. I took all the heavy stuff that I couldn't handle, and I put it in God's palms,
That's
and
right.
he took it, and I carried the light stuff. He took the heavy stuff, and it worked out tremendously for me. Now, that's not
Right.
to say that this cancer is not going to come back, and I'm going to have to face something else. But if it does come back, I'll be ready, and I have
Yeah.
God standing next to me, walking me through it again.
Right. Right.
You can't
You know, I
lose.
have a
Can't
I
lose
have
it
a
to God.
seven I have a 7-year old son, and I tell people, God knows my story. He knows my history. He knows that I grew
Yeah.
up in a single parent home. That I yearned for my pop to be there. He wasn't lived in the same city, but he was doing his own thing. And so now that I have a son, God knows my heart, and He knows that my number one aim is to see my kids as an adult, successful adult. So whatever that needs to happen to make that happen, that's my prayer.
Yes.
I want to see my son with a family, successful. He plays baseball. He says he's going to the MLB, but he's only 7. So, but
Yeah.
that's my prayer, man, and I truly believe that God is going to answer that prayer. So
Yes.
yeah.
That's that's a nice place, Richard, for your words of wisdom.
Ah,
Oh
guess
no.
what I didn't do again? You gotta
We're
remind me.
gonna use the never play leapfrog with a unicorn again, aren't we?
Uh,
Uh,
you sit here.
he usually has encouraging words for us
I
when
do,
we're
and
done
then
here. Now he gets to edit all this out.
yeah, I get to edit all this dead space out because I wasn't smart enough to bring him up before we,
Stop.
yeah.
No stinking thinking.
Oh, here we go. So I don't know why that just pulled up, but alrighty then. That is definitely not what I wanted.
What I definitely don't like are these hot flashes that you get. And women go, "Holy cow, I'm having a hot flash." And you go, "Yeah, how bad can it be? Let me tell you something, my friends. It is ridiculous, is what it is. You wake up in the middle of the night with night sweats and you have all this." So I don't know when someone says, "I had radiation," go, "Okay, I did that. I had hormone therapy. Oh, I did that now." And then the surgery. So I don't know what else I can do. I didn't cyberknife, I guess, in the beginning, but come on. These things are dumb. All right, sorry. It's not funny.
Okay, let me find a good one here.
All right.
All right, here's my words of wisdom. Healing isn't always about curing. It's about finding peace, strength, and joy in the now.
Yeah, I
There
like
you
that.
go.
I like that. I like that.
Okay.
Sometimes
All
it's
right. So we're gonna wrap things up. Yes.
yes, sir. I'm
So
ready.
I want to say this. I
Yes.
want
Okay.
to first say thank you guys for inviting me. You guys are doing a tremendous job bringing awareness to this disease. And man, I appreciate what you guys are doing. And I pray that all of our journeys impact the masses and that we set the captives free. Those who don't believe will believe, and those who doubt will also have a change of heart as well. So thank you.
Yes, sir. And keep us up to date.
Yes,
Yes,
sir.
you definitely keep us up to date, and then we can follow along with your journey as well. Bring you in every so often so we can keep up because I'm curious. I want to know. So
Absolutely.
if you need
Absolutely.
anything from me, yell at me. You
Yes,
can
sir.
get my info from Richard, but if you have any questions, you have something, just let me know.
Okay. Okay. Thank you.
All right. Well, thanks for joining us today, Brian. And until next time,
Yes, sir.
be good.
Hey, we got this, guys.
Yes,
Keep
sir.
fighting.
Yes, sir.
Yes, sir.